All right, so chapter 5, medical terminology. Medical terminology is used to describe and record every aspect of patient care. Most of the medical terminology terms come from Greek and Latin origin. Incorrect medical terminology usage could lead to ineffective or even harmful treatment, could cause a patient to lose trust in your ability. So the use of medical terminology allows you to communicate with persons within the medical fraternity, and it allows easy communication between you and persons within the medical fraternity. Most medical terms have Greek or Latin origins. Already mentioned that. Eponyms are an eponym or eponyms is the name of a disease, device, procedure, or drug based on the person who invented or discovered or first described it. Example, McBurney point, and the McBurney point is from the point of the umbilicus or navel to the right, where you have the superior portion of the iliac crest. And of course, we're familiar with the Foley catheter. Homonyms are pairs of words pronounced the same way but spelled differently with different meanings. So you have dysphagia and dysphagia, both are pronounced the same, but the spelling at the end is different. Antonyms are pairs of word roots, prefixes or suffixes that have opposite meaning of another word. Example, inferior, superior, top, bottom, in, out. Synonyms are pairs of word roots, prefixes or suffixes that have the same or almost the same meaning. Example, adrenergic system, sympathetic system, nervous system, parasympathetic nervous system, cholinergic system. Prefix appears at the beginning of a word. It generally describes the location or intensity of the word root. It will determine what, how, why, or when. Also used to specify time, quantity, or number. Suffix appears after the word root, so the prefix is at the beginning, suffix is at the end. Changes or adds to the word's meaning or provides further definition. Usually specifies a procedure, condition, disease, or part of speech. Word roots establish the basic meaning of a word, frequently indicate a body part. Several word roots are used to describe color. And I mean, there are many examples of that. Leukocytes, white blood cell, erythrocytes, red blood cells. Combining vowels facilitate formation of new or more complex terms. Combining form a word root, prefix, or suffix with a combining vowel. Example, osteopathic from osteon and pathy. That's the disease of the bones. Compound words, terms that contain more than one word root. Each word root retains its basic meaning, electrocardiogram. Thermometer. Electrocardiogram captures the electrical activity of the heart and generates a graph. Thermometer is a tool used to obtain the body temperature of a patient. Plural endings. Rules to change a medical term from singular to plural. Words ending in A change to AE. Words ending in IS change to ES. Words ending in EX or IX change to ICES. Words ending with ON or UM change to A. Words ending in US change to I. Now, topographic anatomy. When we think about topographic anatomy, we're focusing on surface anatomy. And we always picture the patient in the normal anatomic position. This is the patient facing forward with the head in a neutral position, palms pointing forward, and the thumbs pointing outward. Within that position, there are different planes. You have coronal plane, transverse plane, and the sagittal plane. The coronal plane divides the body into an anterior and posterior portion. Transverse plane cuts the body into a top and bottom portion, or superior and inferior portion. The sagittal plane cuts the body into a left and right position. So left and right. If it's mid-sagittal, it's left and right halves. There are also axes. So you have the anterior posterior axis, which is perpendicular to the coronal plane. You have the longitudinal axis, which is perpendicular to the sagittal plane. And you have the horizontal, which is also referred to as the mediolateral axis, which is perpendicular to the transverse plane. Wherever these axis points are found in the body, it means some level of movement can occur or some level of rotation can occur. Specific areas of the body. Many body areas have specific names, and there are body cavities that you need to be familiar with. Dorsal is posterior, ventral is anterior. You have the dorsal cavity, which is divided into cranial cavity and vertebral canal. You have the thoracic cavity, which is divided into the mediastinum, pleural cavity, and pericardial cavity. Within these cavities, you need to know what type of structures are located there. So the cranial cavity, you have the brain and a portion of the spinal cord as it exits the foramen magnum. The vertebral canal is where the spinal cord is found. Mediastinum is where you're gonna have the heart, major blood vessels, the esophagus, trachea. Portions of the trachea coming down. Sorry, not trachea. The heart, major blood vessels, and the esophagus. The pleural cavity is where you have the lungs. Pericardial cavity is where you have the heart. Now, the ventral body cavity is a combination of thoracic cavity and the abdominopelvic cavity, sorry. The abdominal cavity is where you will find the abdominal organs or structures. Pelvic cavity is where you will find most of the reproductive structures within the body. Directional terms. Directional terms describe relative positions of the body parts as well as imaginary anatomic divisions, and they occur in pairs. So you have the midline, which divides the body into two equal halves. You have the superior portion, which is nearest to the head. You have the inferior portion, which is closer to the feet. And when we look at the patient, it's the patient's right and left. Structures close to the midline are referred to as medial. Structures away from the midline are referred to as lateral. Distal means that the body part is away from the trunk of the body. And when we talk about the trunk of the body, it is the chest, abdomen, and pelvis without your attachments. And posterior is the rear, anterior is the front. So just recapping, right and left, it's the patient's right and left. Top and bottom, superior, inferior. Closest to the head is superior, closest to the feet is inferior. Middle and side, medial, lateral. Medial, closest to the midline, lateral, farthest from the midline. Closest and farthest, proximal, distal. Closest to the point of attachment would be proximal. Farthest from the point of attachment would be distal. In and out, you have superficial and deep. So superficial is closer to the surface of the skin. Deep is further inside the body or farther inside the body. Front and back, anterior, ventral, same thing. Posterior, dorsal, same thing. So anterior or ventral is the front of the body. Posterior or dorsal is the back of the body. Now, movement and positional terms. With the extremities, you can have flexion and extension, and that's the bending of a joint. So extension is when the arm is fully stretched out. Flexion is when there is a bend at the elbow. And you can have abduction and adduction. There is no bending of any joint. It's simply moving the limb away or close to the body. If the limb is being moved away from the body, it is abduction. If the limb is moving closer to the body, that's adduction. Now with the head can be in a neutral position, which is what A is showing. So picture A is showing the head in a neutral position. Picture B, the head and neck can be flexed, so the neck can be flexed. B shows a flexed position of the head and neck. And C shows an extension of the head and neck. Hyper indicates excessive movement. Hyperflexion is when the area is flexed beyond its normal range of motion. Hyperextension is when the area is extended beyond its normal range of motion. And usually when there is hyperflexion or extension of a joint, it results in injury. Supination and pronation is specific to the palms of the hand. Supination is turning the palms upward. So the palms, when the palms turn upward, that is supination or supination. Pronation is when the palms are turned downward. So supination is when it's turned up, pronation is when it's turned down. Internal and external rotation. If there is internal rotation, it means the body part is being rotated towards the midline or medial aspect of the body. If there is external rotation, it means that the body part is being rotated away from the midline. An example of that would be if a patient has a posterior dislocation of the hip, then the leg is going to rotate medially. They're going to have internal rotation of the leg if the posterior hip is dislocated. If the anterior portion of the hip is dislocated, the patient will have external rotation of the leg. Now, other directional terms, bilateral, unilateral, ipsilateral, contralateral. Bilateral means it appears on both sides of the midline. The lungs is bilateral. Unilateral appears only on one side of the body. The spleen would be unilateral. Ipsilateral refers to the same side of the body. So the stomach and spleen is ipsilateral. Contralateral refers to opposite side of the body. So the liver is contralateral to the spleen. Now, as EMTs, you learn to divide the abdomen into 4 quadrants. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. And you are required to learn all the structures in these areas. As an advanced or higher, we divide the body into 9 areas. And you must be familiar with the 9 areas. So you have right hypochondriac region, right lumbar region, right iliac region. Then you have epigastric region, periumbilical region, and hypogastric region. And on the left, you have the left hypochondriac region, left lumbar region, left iliac region. Just like the 4 quadrants, you need to be familiar with the structures that are found in the 9 areas. Now, position of the patient, ways in which you can find the patient. Your patient can be found in the Fowler's position, which is what is shown here in picture A. Can be a high Fowler's, which means that the patient is sitting at a 90-degree angle, or it can be a semi-Fowler's position, 45-degree angle. If they're found lying on their back, that's supine. Lying face down on the belly side, that's prone. And if they're found on their side, that's lateral recumbent. If you put them on their side, that's recovery position. Now, abbreviations, acronyms, and symbols. They are utilized in medicine but be careful of the use of abbreviations and acronyms. If they are going to be used, ensure that they are universally accepted. It enables faster communication. Use only commonly understood acronyms or abbreviations. All acronyms are abbreviations, but not all abbreviations are acronyms. Abbreviation is pronounced with each letter separately, EMT. Acronyms form a word, USAR, so that's the difference. Abbreviations, you have to pronounce each letter separately. An acronym, you can call it as a word. Only use symbols that are widely understood and accepted. Avoid using trailing zeros after a decimal point, but include leading zeros prior to the decimal. So don't use 5.0 or 0.5. That can be misinterpreted, especially when we start to look at administering medication. So if it's 5, you just put the 5, you don't need to put a point. If it is 0.5, then a 0 must be before it. So it should be written as 0.5. Very important. And this is a nice little table showing you some of the symbols that can be utilized. And just ensure that whichever organization you're working with, whatever symbols you're required to use, it is universally accepted. Medical terminology related to pharmacology. Be familiar with terminology related to medications and medication administration. So you need to be familiar with the common prefixes, common metric conversion, common medical abbreviations as it relates to pharmacology. And these are some of the prefix and metric conversions that you need to be familiar with. So ensure that you spend time and learn these. We'll go into it much more when we cover pharmacology and drug calculation. That would bring us to the end of this particular chapter. Let me stop the recording.